Hello, welcome back. We are in a series getting a full individualized evaluation in all 8 areas. This is number 7 of 8, psychological evaluation, or in some states we'll say emotional behavioral evaluation. If we haven't met, I'm Mayer Cunningham, special education boss, founder of Special Education Academy, training everyone that sits at the IEP 504 table to navigate and negotiate successful student outcomes. The foundation of how we serve kiddos in school is data. And one of the best ways that we find that data is a robust psychological evaluation or emotional behavior. It's probably the one of the most passed over evaluations because we say goofy things to parents like, did your kid get in trouble? Have they been sent to the office? So we all have behaviors. Some of our behaviors impede our learning. If I did this 52 times while I was teaching, that might impede your ability to want to attend the video or watch, but I do have physicality and demonstrativeness when I speak. And so those are behaviors. And so what are we looking for? We're looking for a behavior that impedes a student's learning or the learning of others. When we're looking at the eligibility criteria that might present under this category, there are 3 of them. Number 1, autism. Number 2, ADHD, which has 3 presentations, right? ADHD inattentive, ADHD hyperactive, and then ADHD combined type, right? And then number 3, emotional disability. And that simply means that your emotions are not calibrated and impact your learning. And so we need to look in all 3 of those areas. Those 3 things, autism, ADHD, and emotional disability, really overlap each other and can have very similar presentations and characteristics. So we need to make sure that we are drilling in the right place, that we've identified the right eligibility, so that we provide the right IP goals, support services for that student to be successful. What are the other things that we might look at in an evaluation that may not be criterion based? We're going to look at their behaviors, the functions of those behaviors, and that's called a functional behavior assessment. And that is by the school-based members, to include, of course, the parent, and when appropriate, the student, to see if there's a function that's extreme or high impact in the classroom that's impacting their learning and or the learning of others. That's put together by the school-based members, parents, and everybody involved to look at what is the behavior, what's the beginning of the behavior, what predicates it, what can we do to offset it, when does this behavior present, when does it not present, what things have we done in the past that worked on the behavior, what things were ineffective, so that we've captured all of that. And then based upon the results from the FBA, a functional behavior assessment, we then might need to develop a behavior intervention plan, right? So I've got to intervene because of the acuity of this behavior to mitigate its outcomes. And so those targeted behaviors that we identify in the behavior intervention plan then also become IEP goals, right? So if you have a kiddo that has physical aggression and outburst, they're your 2 targeted behaviors in your behavior intervention plan. Then we make them like a matching IEP goal so we can work on them across settings. Very important to remember that when you have behavior goals, we're working on them where? In the school, the whole in the social skills class, which is great, but that's probably where the behavior presents in the least amount because you have the highest support during the social skills class. We want to make sure that we're taking data across settings. What else could you look for in a functional behavior? I'm sorry, a functional behavior assessment might then lead you to identify other needs, right? So you might have a need for social skills. That is a curriculum that can be taught to kiddos. They can be attached to IEP goals. You could also have counseling as a related service. And what is that? That is exactly what it says. It's a related service. You want to ask for that. And it's contingent on 2 things, right? Does the student have the ability to understand the skills that are being taught and then work on them, generalize them, and then have fluency in the classroom? So there's a cognitive component, an understanding component. We can identify those behaviors that are impacting me and my learning at school, and skills and strategies to overcome those deficits. And then next we would look at executive functioning, right? That ability to know what to do in situations, so that we have better outcomes. And so that's a really general, broad overview, but the psychological evaluation should be robust. When we're asking for people to participate, I want at least 2 of the students' teachers to participate in all of those areas. When it's appropriate, I want you to also do an interview, a student interview, because kids are really amazing, and they'll tell you what they need and what's going on. And then also important that we remember to include the parent, the parents, the step parents, where appropriate, maybe even a grandparent. Maybe a grandparent provides after school care or before school care. They might have valuable pieces of information. If that student went to vacation Bible school over the summer, or the student goes to a daycare over the summer and they have support or they don't have support, what about those settings are driving good outcomes? We want to know all of that. We certainly want to know in that area if there's any emotional, psychological, neurological need that can be supported by an outside counselor. Want a summary letter from them. Are you seeing a physician for any of those needs? Is the student being given behavioral goals that they're working on, or systems that are in place? Is there a medication routine? Is the medicine dispensed at home? Is the medicine dispensed at school? We need to know all of those things and its efficacy so that we can best serve a student in the psychological behavioral area. If you need anything, let us know. We'll see you guys in the next training. If you have any questions, email us at advocate@specialeducationacademy.com.